Hello, everybody. Thank you for coming. We're going to get started. My name is Elena Scheck-Snyder. I am a NAMI Coastal volunteer. I facilitate our People of Color Connections Recovery Support Group and also do interim voice presentations, among other things. I work with the City of Virginia Beach Human Services as a peer recovery specialist in crisis management, which will play a role in the Marcus Alert implementation. And I'm so honored to introduce our speaker for this community meeting. But before I introduce Mr. Todd McGehee, I please ask that everyone make sure to be muted. If you have questions, please type them in the chat box. And Mr. McGehee is the Marcus Alert Program Regional Liaison, and he will discuss the Marcus Alert and 988 implementation because it looks like we have a lot of people interested in learning more about this. When he is finished presenting, please look for questions in the chat. I will look for questions in the chat box and go over them. And if you have a question, you can raise your hand. And I will go ahead and let Mr. McGehee take over.
All right, good evening, everybody. As Elena said, I'm Todd McGehee. I'm what's called Region 5 Marcus Alert Liaison or Coordinator. And I'm currently basically working with Virginia Beach. And any questions that you have tonight, I'll do my best to answer them. It's a relatively new program and it's still in the pilot phases right now. So if you can share your screen, Elena.
Sure.
Thank you. All right, and Elena, if you, since you're hosting, if you wouldn't mind keeping an eye on the chat or the where people's markers are to see if anybody's raising their hand, and please feel free to ask any questions if I'm not clear, if you don't understand any of the material.
Absolutely.
Okay, so just overall vision statement, as everybody can see, this is a City of Virginia Beach. We want to foster wellness in the community through a range of services.
Sorry.
That's okay. That is sensitive to individual cultures and respectful of their trauma. We utilize well-trained and competent professionals who respond with empathy to behavioral health emergencies while treating everyone with unconditional respect and dignity. Our approach links individuals with appropriate resources while achieving safe and desirable outcomes in the community. So what we're trying to do is basically respond to individuals that are in crisis, that usually dial 911, and rather than sending law enforcement out to meet them, we're sending mental health professionals. And in some cases, depending upon severity, which we'll get into in a moment, there may be law enforcement involved. But for the things that we can handle from a mental health perspective, we're trying to send people out to the field to assist individuals utilizing our skills rather than law enforcement. Next slide, please. So we went live. It's 988 is working right now, but it's not working. It's still a brand new system, so it hasn't completely integrated into our systems. Also, we're having, we don't have a GPS location right now for it. So we're using other services to assist us with responding to individuals in our city. And this is a collaboration between the Virginia Beach Department of Human Services, Emergency Communications, Citizen Services, the Virginia Beach Police Department, and all community stakeholders. And the whole purpose, this is basically the beginning of us enhancing our crisis continuum of services. We want to increase mobile crisis response services. And that's basically what I gave an overview of a moment ago, that we're sending mental health people out to assist individuals that are in crisis. We want to promote early intervention and prevention techniques to de-escalate crisis situations and support warm handoff activities. And that entails not just responding to an individual that's in crisis, but helping them, of course, de-escalate, get calm, and then getting them into services as soon as possible so they can get into treatment or get whatever resources they require. So there are 6 state level components of the implementation plan. We have a 4-level urgency triage framework, and what this entails is basically just when the call comes in, assessing the level of urgency and determining who the best responder should be, whether or not it can just be somebody that's talking to an individual in crisis over the phone, or whether or not we need to send a mental health team out there, or whether or not we need a co-responding team of mental health and law enforcement, or if law enforcement needs to be there, or also EMS. This is all based on a federal 988 implementation and regional call center. So it's not just the individual like 911 operator services for your city. This is going to be a regional call center that's basically operating throughout our region. And the city's in what we call Region 5. The statewide equity and INTERCEPT Zero initiative. We just want to serve everybody in the community as much as possible. And the Zero INTERCEPT initiative is getting involved with individuals before, like say if it's something sort of simplistic, like they're trespassing, but it's the result of their mental illness, then we want to get them into treatment rather than getting them arrested. And that's what our Zero INTERCEPT initiative is. Right now, the Department of Behavioral Health and Developmental Services, along with the Department of Criminal Justice, is working to create statewide training standards for law enforcement and the mental health responders. And overall, there's going to be a statewide public service campaign where everybody has access to services in some capacity. So this is the triage framework for assessing risk. This is basically what we're using to determine who responds to an individual with crisis that's in crisis. So as you can see with the behavioral health response, that's basically somebody on the phone that's talking to an individual in crisis. And if they need to talk to somebody else, we have warm lines where we can hand them off to another individual and identify referrals for the individual if there's services that they can follow up with or get connected to. And then as you can see, the moderate level 2, we're going to send out. Did someone say something? Did anyone have a question?
No, I don't believe there was a question.
Oh, okay. All right. So like I was saying, with the level 2 moderate response, this is where we're going to send out a mobile crisis team. We have trained mental health professionals that will respond to crisis. And of course, anyone within our safety who's dealing with public safety will be notified when these teams are going out. So if law enforcement is needed, then that's coordinated through our regional call center or our 911 center here in Virginia Beach. And then of course, level 3 is urgent. And that's where this is where we have a law enforcement, a police officer and a licensed clinician go out together. And that way they can maintain safety of the scene while the counselor is getting involved with crisis de-escalation and assisting the individual with any kind of resources. And then of course, law enforcement response is the way it's been going, and sort of the purpose of this program is try to, as you can see, alleviate the majority of officers responding to calls that don't require law enforcement. So with a law enforcement response, then you're going to see that, of course, law enforcement is going to go out. These are going to be crisis intervention team trained officers in Virginia Beach, and they'll determine when to bring in the mental health professional to assist in that particular call if needed. Next slide.
Before I go, there is a question if you don't mind.
Yeah, please bring it on.
It says, who determines the level of care that is needed, and what type of training do the mobile teams have?
The level of care is determined by the this can be the dispatchers are being trained to identify what that level of response is, not so much level of care. That would be a different thing when after the individual is in crisis, they get referred to services, and then that will be assessed. But when it comes to responding, um, the training's being given from the 911 operators that have been doing this forever, and the licensed professional counselors are determining how to identify what level of response is provided. So there is some basic criteria, but a lot of this is in draft form right now. So I can't give you specific details. It's just it'll be a level of urgency, like the difference between if anybody has been through any kind of suicide awareness training. There are things that we call risk factors, and if there's risk factors, if there's several risk factors involved, based on the number of risk factors, that's going to indicate the level of severity when it comes to the level of response. So if there's any indication that somebody might be in danger, of course, law enforcement is going to be involved. I hope that answers the question.
Okay, thank you. That was the only question.
Okay. So right now we're just standing up. Like I said, this is a pilot program in Virginia Beach. So our mobile crisis response teams are only working Monday through Friday from 9:30 a.m. to 10:30 p.m. With weekend coverage. Right now we are advertising a maximum 1 hour response time. We've been staying well under that in the pilot program in the few calls that the mobile response team has responded to. And they're all interconnected and staying in close communication, with occasional checks with the regional call center to make sure that the teams are safe. But we're always ready to call law enforcement if the situation escalates. If there's a question as to whether or not it may escalate, we do sometimes contact the 911 and request that any law enforcement officer or roving patrol that's in the area that the team will be visiting to sort of be on standby, just in case we require law enforcement get involved. And the regional crisis hubs, we work with existing crisis services for warm handoffs and continuum of care. So our regional crisis hub has been amazing when it comes to identifying resources and connecting individuals and doing follow-ups with individuals after a crisis event. So definitely there's a concentrated concern on ensuring that people aren't just responded to and then left, that they do get into some kind of services, that they are given resources, and that follow-up as to whether or not the resources worked out or whether or not they needed assistance connecting.
Meeting is being recorded. Okay, thank you so much.
Was there a question?
Okay, there is a question. It says, how many responses have there been, and what is the overall quote unquote feeling of the effectiveness of this response?
Well, the last report that I got, I can't remember the time period either, because we're working on this week to week. So I think in the case of, and it's not just response, it's also what we call the National Suicide Prevention Lifeline is handling the 988 calls right now. So out of, I think in 2 week period, and I may be wrong, and the individual who gave me the numbers is actually on here, but I won't call her out and get her involved in this. But I think it was a little over 180 calls. And our mobile response team has had to respond to, I think, 4 or 5 of them. But the thing to identify here is that these are the 180 calls that were served were calls that normally would have gone to 911 and had a police officer involved. But mental health professionals assisted with these individuals. And on those 4 or 5 calls that mobile response team had to go out, they were very successful. The individuals got into services. Regional call center follows up with them, and they're very satisfied with the response. And our clinicians are very, you know, they're getting very motivated to continue doing this.
Awesome. Thank you.
You're welcome.
Todd, I'm happy to help if you need me to.
Who is that? Staci, thank you.
You're welcome.
I didn't want to call you out like that. Have I gotten any numbers wrong yet? Do you want to elaborate on those?
Hello, everyone. Not trying to steal the presentation here. We had 185 calls transferred to the PSAP, most of which were what he called a level 1, which means it just required some telephone support. All of the calls from the PSAP that go to 988 is going to a national accredited suicide prevention lifeline to answer the other questions. So they are trained and contracted through the regional hub with monitoring. And we dispatched out 9 mobile teams, and that's for the month of December.
Oh, that's awesome. Thank you so much, Staci. That's very helpful. And feel free to chime in at any time. All right, so here's the numbers. Like I said, the 988 on cell phones is working very well. But based on network systems, and I think trying to get the carriers involved, if you're not using a cell, if you are using a landline, then 656-7755 is the number. The regional call center is active 24/7. And right now, Western Tidewater Community Services Board is the ones who are managing the regional call center. And that was Ms. Staci Young, who is a supervisor out there and is doing just the most incredible job. Like I said, I'm Region 5 and included in Region 5 right now with the Virginia Beach Department of Human Services. Eastern Hub is Virginia Beach, Norfolk, and Eastern Shore. Virginia Beach being the pilot program right now, that means that in certain situations, if Norfolk or Eastern Shore calls in, Virginia Beach mobile response team will respond to those calls. Next slide, please. So the equity at INTERCEPT 0 that I mentioned earlier, and I'm just going to go over this. It encompasses a collaborative early intervention points between behavioral health responders and law enforcement for people with mental illness and substance use disorders prior to being charged for an offense, which is accomplished by the following. And this is what I had talked about earlier. I sort of get ahead of myself sometimes, but accomplishing this involves not just the law enforcement and mental health providers, but also the public-private collaboration with Virginia's crisis services, and the training and development to integrate small community-focused providers into the crisis service system. So right now, Western Tidewater is in the midst of meeting with several private providers to assist with our crisis services. So we're trying to build these services up to be not only as efficient as possible, but just pretty much cover the whole spectrum of mental health assistance. So we're trying to collaborate with as many individuals that want to be involved with our crisis services and our crisis continuum. And we want partnership around language access and other critical projects to ensure equitable access to crisis services. Development of a Black-led state crisis coalition to review ongoing development of the Marcus Alert implementation. This is what we're doing to be as inclusive as possible with the entire city, in assisting us not just as stakeholders, but as advisors on what type of services you prefer and what you would like to see in crisis response services. Next slide, please. So there's going to be statewide training standards. Like I said earlier, right now, the Department of Behavioral Health and Developmental Services, along with the Department of Criminal Justice, is creating standardized training for behavioral health, law enforcement, public safety, the dispatch. And it's in the process of being developed. They've got a lot of subject matter experts that they're consulting with, and basically making sure that it doesn't interfere with current training standards or the type of training that goes on with behavioral health and law enforcement, trying to standardize it for the Marcus Alert and the mobile response teams. So they're also trying to, they're getting with certain vendors for and curriculum specialists to develop high quality training and the training material. And they're right now, the current projection is to have those trainings completed by July 2022 and start getting them implemented throughout the state. And basically all professions involved in the Marcus Alert System are eligible for the training. And that's going to be really convenient when everybody's talking the same language, especially when we have a regional communication centers for the entire region, because it'll just help having everybody on the same page and not having to learn different processes for different cities. Next slide, please. So right now, I actually had a coordinators meeting today with department DBHDS, and they are working with vendors for advertising, and they're trying to get that as standardized as possible, not just for the state, but also for our region. And based on a community input survey, they want to make sure that this kind of information is implemented when we start advertising. The availability of 988 for behavioral health crisis, because a lot of people, even within law enforcement and mental health, don't know that this is actually has already been activated. And we want to stress the importance of calling early in a crisis, because a lot of times what gets to the point where law enforcement has to be involved is somebody waiting too long when there's already signs that the situation that they're in is problematic. And then we want to create a range of lower level supports, and including warm lines, so we can physically hand the individual off to another person on the line, especially when it comes to referring them for services. That statistically is shown to be much better when it comes to individuals actually engaging in services, rather than just giving them a resource with a contact number and telling them to call the next day. Next slide, please.
Actually, it looks like there is a question.
All righty.
Okay, it says, what can we do at a local private practice level to either advertise or get trained? And not sure how we fit into this outside of telling patients to call.
Right now, that's like a question hopefully we'll be able to answer after July 1st, when the training's been implemented and we have a better understanding as to who's getting it and how it's going to be basically opened up. I'm sure I'm pretty sure that with the first wave, it'll probably be tight to get outsiders in, because I'm sure the state will want to get all the active responders that are currently involved with the program to go through this training immediately. So that'll probably be something I could answer better, like I said, once July comes around.
Okay, awesome, thanks.
Okay. So for community coverage, these are the minimum standards for community coverage. And this goes back to our level of response that we talked about earlier. So when we have level 1 calls, say they come in through what we call it the public safety access point, or PSAP, when those calls come through the normal 911, those will be automatically diverted, if they're identified as level 1, to 988, and that will clear it for the 911 operators so they can continue to respond to public safety. And then level 2, coordination of community responses. We have mobile response team right now where mental health professionals go out and assist the individual face to face. And then once it gets a little bit more severe, a level 3, then that's coordination between behavioral health and PD. And like I said earlier, as to whether or not the police department will either, be in the area or respond and just make sure that the scene is safe. There's also added provisions for response to adult, youth, and individuals with ID and DD. And then level 4 must receive an emergent response where the dispatch is not delayed. So that's not going to get routed to 988. 911 will handle it, and they will dispatch either the co-respond team or police officers and the co-response team. Next, please.
It looks like we have reached the end. So if there's questions.
So I see Stacy's note here. Thanks, Stacy. I'm going to read that online. Please use the community line number in the presentation. Oh, wait, this might be
wait, sorry, let me
Elena.
stop.
Yeah, sorry, Stacy. So that's all that I've got. Hopefully I didn't make this confusing. Are there any more questions? I'd be glad to answer.
I was referencing, Todd, you gave the community number in one of your slides to the person who's local. You mentioned 988. Right now, 988 gets routed through your area code. And because Virginia Beach is such a tourist area and is such a transient area for people moving here and military, etc., we have a local community-based line, and it was listed in your slide earlier, that line directly links you to the regional call center, which is the suicide prevention hotline and all those amazing community resources and hard work that Todd's been talking about. So that's one way a private provider can assist in, starting this process.
Excellent. Thanks so much, Stacy, for clarifying that. Anyone else? I went rather quickly, but the main thing right now is, I guess, as an overview, is just to realize that with the number of calls that Ms. Young was talking about, those are calls that are being taken away from law enforcement and being handled with mental health professionals. And the other interesting piece of that is not only mental health professionals are assisting in that crisis moment, but we're also working to ensure that individuals are connected to services afterwards if needed. And that's the key. That's much more complex than it used to be, where the individual was, where an individual is either incarcerated, or if they're, based on their mental health, if they're a danger to themselves or others, or they're having difficulty caring for themselves, then they're mandatorily put in a treatment facility of some sort. So we're doing what we can to try to reduce those kind of situations and ensure individuals are getting into services as soon as possible, because statistics do show that an individual that is incarcerated, if they are, say it's first episode that they've dealt with their mental illness, that their condition will deteriorate. Whereas when we can get them into services as soon as possible, we've actually seen in some cases it just about reverses or alleviates their symptoms.
Todd, I have, well, I guess my first question, and then there's a question in the chat box, and please, everyone, please feel free to, post a question or raise your hand. But do you mind maybe going over, the reason for all of this legislation for the Marcus Alert, and, tell us maybe about the young man who's at the heart of this?
Yes, Marcus David Peters. I know I read the articles on that particular situation, but if anybody else is on the line that knows the situation better, from what I understood, this was Mr. Marcus David Peters was a school teacher in Richmond, and he was he had a psychotic episode, and somehow it escalated with law enforcement, and he was shot and killed. If someone else would like to, and that happened in 2018, I believe. If anyone else has more details with that, that's what initiated getting mental health professionals involved as soon as possible, before it escalates to that.
Thank you. Okay, next question. It says, so does this mean if someone is really struggling at home that the mental health responders plug them into care? Is that a level 1 call?
I could say, I mean, just from that, as a mental health professional, I would say that would be a level 1 call. We're looking for some kind of, when it gets to a level 2 or level 3, we're looking at some kind of potential for self-harm. So that one looks like it's being handled in the interim. So I would say that would be a level 1 call. And in those situations, you know, when those calls come in, our call center asks several questions to try to identify what that level of calls, get as much information as possible. So we're dispatching the appropriate group to the appropriate call.
The follow-up piece to that, Todd,
Yes, ma'am.
to piggyback with you is, if it's even a level 1, let's say that person got some support that night, maybe they called like at 2 a.m. and they just needed some phone support but need help getting services. The regional call center has navigators that call can be assigned to, and they will reach out the next business day to sort of try to link, coordinate, and see what other resources the person might need. It's always consumer choice, but we will try to reach out and offer and say, you know, do you have a private provider? Can we help you maybe get an earlier appointment? What is your barrier to maybe going to an appointment? And try to link folks to the appropriate resources to plug them into care. Or if maybe someone's just not ready, have that conversation about what might it take for you to be ready to take that next step. So even if it's handled at the call center level, at that time, there is a way for them to be assigned to a care navigator that will do some additional outreach to try to link them to services post-crisis.
Yeah, that answers it all. Thanks, Staci. Any other questions?
So another question is, what if a clinician team responds to a call and when they arrive on the scene, there's a weapon and the weapon wasn't disclosed during the call? What would happen?
I'm pretty sure they call in law enforcement immediately. And it's
That's where our dispatchers are also involved. They're doing the welfare check. So the follow-up question would also be, is that weapon presenting a threat? Like, are they threatening to use the weapon, or is just literally the weapon in the home? Because we have several people who own firearms and hunt and do various, you know, sporting events. So
That's
part of it is not just the weapon itself. And those are some of the questions we ask is around some of that, but is there a risk involving that weapon? And if the situation escalates, we have a safety measure check, and I'm not going to disclose that to protect our mobile teams, but there is a way to alert us to ask for additional assistance to be sent to the residents to help protect the mobile responders. But it doesn't necessarily have to be just because a weapon's there, a no-go. It's what else is going on. There's a lot of risk factors. So that's why we do a lot of that clinical triage and continue to do that on scene and with additional supports.
Thank you. Let me see. There's another question.
okay.
It says, will the mental health responders be dressed in a certain uniform? I had a parent ask me that and asked me if officers would always be fully uniformed when they come out too. I think this was pertaining to some paranoia and fear of police.
There's a lot of talk about that right now. We're in the pilot stages, and we are following a lot of other models around the country to see what's most successful. Of course, if there's any change in uniform with law enforcement, that's going to be up to the police department. Right now, we don't have anything identified as uniforms for our mental health professionals. So they're just wearing business casual to work like any other day.
Okay, awesome. Another question is, what has been the most difficult issue with the Marcus Alert rollout so far?
I think from a regional standpoint is the most difficult issues really would be staffing, believe it or not. There's a national shortage of mental health professionals and law enforcement right now. So that would be probably the most difficult issue. We really got lucky with Virginia Beach because we were able to retask individuals that were already employed, which allowed us to stand up this team as much as possible. Of course, as Ms. Bay said down there, yes, COVID is a major problem, especially when it comes to any kind of face-to-face response. So yeah, there are kind of issues, but right now staffing seems to be the biggest issue. Luckily, the 988 system is rolling out the way it is, so we're able to test the waters before jumping in completely. So we have meetings every week that we're looking at lessons learned, and we're doing everything to basically improve the process on the fly. I can tell you, I've been on board for a month, and the progress that the call center and Virginia Beach has made and standing up the program has just been phenomenal. And I can tell you that what it was 30 days ago is not what it is right now, because it's improved tremendously. It's just everybody is constantly involved in working out the bugs and trying to get this work. It's a very proactive attitude, and a lot of us have a great deal of passion for doing this kind of work. So we've got an awesome team involved.
Thank you, Todd. You're awesome. The last
Thanks,
question that I have, and you kind of already addressed this, is 988. So apparently the landlines are unable to access 988 and still need to use 911. So when will the landlines be able to use 988, if you have a projection at all? I know it's still in the works.
Yeah, I'm not sure. That's being worked on, but there's certain situations, and I'm not sure if the landline issue is part of it, but there's actually authorization from the Federal Communications Commissions that have to go through before some of the aspects of what we're doing can smooth out. So right now, it all being new, it's just
Mid-July.
Yeah, mid-July. Okay, thank you.
Yeah, mid-July is when the federal government states that 988 has to be implemented on some level nationally, and so that's the goal live date. And again, even when that gets routed nationally, I want to emphasize that that is routed by your area code. So again, if you are someone that lives in this area or in the Region 5 area, and you have an out-of-state area code, then you're going to get routed to that state first. So that's why we created this local community landline number that will directly link you into these local based services and get you that Marcus alert team and get you those mobile responders that Todd's awesome about talking about. So again, that's when people ask, what can we do? That's the number that I am really suggesting right now, that we use more than 988, because of the tourist area and the fact that so many people move here and retain, wherever they lived. So I want to make sure people get the services that they need most appropriate.
Thank you so much, Staci.
All right, it looks like we have a few more questions. And I just want to say, I posted in the chat box, the program will be on, it's being recorded, and so it will be on our website soon. But in terms of the slides, I'll have to get back to you. So if you would give me your email address, I will take note of it. But again, this will be on the website soon. Todd, question?
I put my email address up on the in the chat, Elena, in case anybody has any questions later.
Yes. Do you mind letting me? Sure. The question is, what is the local based community line number? I'm not sure what that is referring to, 988 or 911.
That was what Staci was just talking about.
That's
Okay.
the number I'm referencing. I'll get it and put it right in the chat for you. Just give me 1 second.
Okay, thanks. Um, Miss Julie, is it
Truitt.
Truitt?
Yes, thank you. So when you say on your website, is that the Virginia Beach website? Is that the NAMI website? Which website is it going to be on, the recording?
I believe that's our NAMI Coastal website. I
Yes.
posted it in the chat, namicoastalvirginia.org.
Got
Are
it,
there
thank you.
any? Sure. Are there any more questions?
I see a hand up, Ms. Truitt. Hands down. Stacy posted the community line on the chat box. And if those of you, if you're on a phone or something like that, the number once again is 757-656-7755.
And Todd's email address is in there as well. So if you have questions.
Hello, this is John Buckner. Can you hear me?
Hey, John.
Hi. Hey, there was a lady, I think I saw a question in the chat about, is Norfolk supported through the Marcus alert? I didn't hear you get to that question. So to answer, I am going to be the Marcus coordinator for Norfolk. To answer the question, Virginia Beach, the Marcus alert right now is not, Norfolk is not included in the Marcus alert. We will be in, I think it's 2024, if I don't have my dates in front of me right now. But they do have a mobile crisis team that responds to our, the citizens in Norfolk if they call the number that Stacy provided. They are supporting us right now through a mobile crisis team. But as it just regards to the Marcus alert, we are not a Marcus alert community as of yet.
Yeah, but we got you covered right now.
You do, thank you.
Yes, sir. So yeah, like I said,
I think what's important is, sorry, is
Thanks,
there's
Stacey.
sort of like several initiatives going on in crisis transformation throughout the state. So we have Marcus and we have Marcus alert communities, and eventually by 2026, every community in Virginia will have to basically come up with a plan, like Virginia Beach did, about co-responding and handling behavioral health emergencies. And we'll have to use those transfers to 988 from on those level 1 calls. But we have, anyone can access mobile crisis supports. Anyone can access the suicide prevention lifeline for emotional support and linkage to ongoing services. So there's so many amazing things going on. And sometimes I think it gets all lumped into one thing and we think, oh, well, if it's Marcus, it just only happens in Virginia Beach. That co-response absolutely does, but I want you to all know that those other supports are happening throughout the Commonwealth right now. So feel free to share that with your other providers, your friends, your family, loved ones, that, you know, we're really trying to build more infrastructures. There's other initiatives also happening in the community, like community receiving centers and additional crisis stabilization units, which are basically a step up from home service, but they're not as restrictive as a hospital, and they're a voluntary service. And we have one in Western Tidewater that will be starting mid-February. Hampton Newport News is expanding one. And we have some crisis stabilization centers. So there's lots of things that we're trying to build into the system of care to help assist individuals who might be experiencing a mental health crisis, or someone who maybe lives with periodic episodes, lifelong challenges. So, and we still do have our IDDD teams through REACH, and they will be they can be accessed through the same community-based line. So there's a lot of great things happening. Like Todd mentioned, staffing is an issue. So some of them have limited hours, and we're working towards that 24-hour capacity. We're trying to work on expanding those things. Funding, of course, is always an issue. I'm sure some of you all know about the funding issues, but there's a lot of levels. So even if Marcus isn't, somebody asked about Norfolk, it's coming to Norfolk eventually. It will be coming to every locality eventually.
Yeah, 2025 is for us, July 1st, 2025 is for Norfolk.
Yeah, and that's really helpful that John Buckner is already involved in that. I mean, you can see it's a couple of years until the team will be stood up, or at least it's projected to be stood up, and John's already coordinating that. So that puts Norfolk way ahead of the curve.
Staci, you talked about the hours. There's a question in the chat box and I think we already addressed this, but it says, what are the hours of the community line?
Sure, you can access the community line 24/7, 365, and 366 on leap year. Okay, so that community line is always staffed by our National Suicide Prevention Lifeline providers. Our dispatchers are 24/7, 365 as well. What is limited right now is our mobile teams, because we're still in the process of hiring and expanding those out. So we don't have mobile team coverage yet 24/7. Mostly it's during the peak hours when we've looked at statistical data of when people have needed the support the most. But for example, we don't have teams on at 2 a.m. right now. We don't have mobile responders that could respond to someone's home at 2 a.m. But the goal is to expand that capacity over time to be able to offer that level of service as well. But the line itself is a 24/7, absolutely can call anytime, day or night resource. And our dispatchers are always on as well. Navigators are currently going to be Monday through Friday, more standard business hours, because again, that is a post-crisis sort of linkage, ongoing care, some short-term kind of case management types of services to make sure we link people ongoing.
Thank you. And here's a really great question that I can relate to as a person with lived experience. It says, what if one person in a crisis is a repeater, what I call a frequent flyer, and how does this get handled?
And that's actually one of the initiatives within the whole level 1, level 2 kind of thing. That's why it's imperative, like I said, with the warm handoffs, it's imperative that we get mental health people out to the scene immediately, as soon as possible, to not just interact with this individual from a de-escalation standpoint, but to identify services. And like I said earlier, to identify those warm handoffs where we can get in touch with individuals right now, because that just increases the efficacy of them getting into treatment and staying in treatment. And that's where we're hoping. I mean, obviously with what we've called frequent flyers, there's a need that's not getting met. So we're gonna be establishing, we're gonna be providing more service, more time to that individual to see where those shortcomings are and what it is we can do to reduce those number of calls, because obviously they feel they're in crisis, and until they get stable, until they're comfortable, whatever it may be, medications, therapy services, anything like that, then they're going to continue calling and asking for help. So this will allow us to be more hands-on in those cases. And we have talked about it. We do perceive a reduction in those frequent calls from individuals. Excellent question.
Yeah, thank you. Are there any more questions, you guys? We have a few minutes. Alrighty. So I just want to thank you, Mr. McGehee. It's so awesome that you were able to join us and provide such wonderful information.
Thanks,
And
Elena.
yeah, and also Ms. Young, thank you so much for providing your expertise in this. And I just want to go over a few things before we close out. We already have your email address, which is great. So if you guys have questions for Todd, please feel free to reach out. And also NAMI Coastal plug, we will be having an Ending the Silence presentation next week on January 26th at 7 p.m. via Zoom. Of course, this is free, and all of our classes, support groups, and presentations are free. And the calendar and registration information is on our website, namicoastalvirginia.org. That is in the chat box. If you have questions, please feel free to call 499-2041. And thank you guys so much for attending. And thank you, Mr. McGehee and Ms. Young, for taking time out of your schedule to join us. And I hope you guys have a wonderful rest of your evening.
Thank you, Elena. Thanks to everyone that helped out. Appreciate it. You guys have a good night.
Bye.
Bye
Thank
now.
you.